a new program in heart failure, and in particular a new chemistry or novel agent that has been explored in an early phase 2 study. Well, one is that patients, nearly 500, were recruited to evaluate this new drug, and so naturally there was a placebo-controlled blinded comparison and then a series of groups at different doses to see whether the spectrum of dose could enhance the outcome and the performance and the measurements that were undertaken, and followed for 12 weeks, and conclusions reported. It's tough to pronounce. It's called vericiguat. It is even tougher to explain, but it's a novel cyclic guanylate cyclase stimulator, which is a substance in the heart cells that affects performance. And so this stimulates this that appears to be deficient in heart failure, overcomes the deficiency in heart failure. Findings were really threefold. One, that the proxy for heart failure, which is natriuretic peptide, which is a substance that circulates in the blood and is a pretty good indicator of what happens in heart failure, was reduced in the highest dose, not in the top 3 doses as was originally suggested, but in the highest dose. Second, that there was some improvement in the performance of the heart based on echocardiography or ultrasound. And the third, that there was a suggestion again of improved clinical outcomes, although the data are not definitive on that point, but they point in the right direction, which is reassuring in the phase 2 study. We have a substantial unmet need in heart failure, right? And despite all of the medicines that we have, we still have morbidity and mortality that's significant. So taking a new pathway and a new avenue and adding it on to what we already do, the hope would be then that we would reduce the hospitalization and death from heart failure. In this instance, this is the first of a 2-part symphony, if you will. This is studying patients with so-called reduced ejection fraction. So they have, there's a number which basically signals how well the heart contracts, and so if you had to have a decrease in your ability to contract the heart to get into this study. And it accounts for perhaps 50% of the heart failure population. There's a second group, so-called preserved ejection fraction heart failure, and that study with this drug is in the cooker. We don't know the results. Some of the medicines in the ditch were ones that seemed to improve performance but actually made the patients worse. Some of them died faster. So it may be that we clubbed a tired horse uphill and tried to make it do something it didn't want to do, and it ultimately complained, maybe disturbances of heart rhythm. Second is that although we say we classify heart failure into these categories, our taxonomy and our ability to truly understand the multiple causes is, I think, at this point, still inadequate. So we're learning, and there may be lessons in proteomics and molecular biology that will allow us to better classify patients into categories that are more discrete and that may allow for a more precise application of certain medicines in some patients as opposed to the way we do it now. We have 3 goals in heart failure. Number 1 is that we would like to make our patients feel better, and in the course of that, retard the progression of heart failure. The second would be to reverse the process, so-called reverse remodeling, where the shape and structure of the heart might be able to return to a more normal situation. And of course, the third is, can we improve survival? Because the mortality from this disease is horrendous, and it's a big ticket item, very costly, and so that would be a perfect win, would be to put those 3 things together. We don't know that. We hope so, but at the moment we have signals that it improves performance. And as I indicated to you earlier, we also have a suggestion that it may, in fact, make patients feel better. But that's why larger studies of a more definitive nature are required. This was a few hundred people, and to nail down what I've told you would take a few thousand people. Remarkably few. Now, the most important concern was the potential for low blood pressure, because this may have an effect on vascular tone in the periphery. But in point of fact, and that's the virtue of a placebo-controlled trial, patients in the placebo group also had some drop in blood pressure over time, so it was very well tolerated. I think the conclusion of the presentation here was that it warrants further investigation. And so I think that from a phase 2, we've learned that there's a signal here, and I think combined with the unmet need and the novel chemistry, this deserves a fuller, more complete investigation. And obviously that's a matter for discussion and future planning.